Hello and welcome back to our video training series on how to identify and treat structural dysfunctions that are often the root source of our clients' chronic pains. In this video, what we're going to focus on is what the Hesh method uses as really truly a differentiator from other types of testing out there for proper joint mobility at the level of micromotion. We talked about micromotion in a previous video, so go back and review that if you need to. And now we're going to talk about how do we identify these subtle micro restrictions in the joints. The traditional way to assess subtle micromotions in the joints is a category of evaluation called spring testing. The Hesh method uses an advanced form of spring testing that I'll tell you more about in just a moment, but let's understand what basic spring testing is that's used out there widely as the way to look for micromotion restrictions. A basic spring test, you're going to typically use your hand and you're going to know where to place it on a structure at or near a joint, and you're going to know what angle and what amount of approximate force to use to go directly in and come directly out of the tissues. Checking to see if there's motion there. Is there adequate spring of that structure? So that's a basic spring test, just in and out. One time, was there movement? If so, is it sufficient? What Jerry Hesh identified through lots of work on his own body and then many clients over many years is that a spring test oftentimes gives an inaccurate result. Most commonly, the problem will be is that it'll assess that there's motion there in the joint that's sufficient when there's actually not. So what Jerry has come to use as the way to assess for these micro motions, it is called a recoil spring test. So it's a second step in the spring test process. So in the case of recoil spring test, you're going to go in slowly, take up all the slack in those superficial tissues so that you get to that barrier, a barrier of resistance that is created from the extra tension and that density of those deep joint tissues. So now we've loaded the system to where all the slack is taken up in the superficial tissues, and now we're going to give another test, a spring in and out, to see if there's movement down there at that deepest layer. So a spring test on my index finger here would be to just take it and push it as far as it'll go and release. And basically is there movement there? Usually there's going to be a good amount of movement when you're just going in and coming right out, because there's a lot of slack to take up before you meet an initial barrier. That initial barrier is where you're going to be beginning to load those deepest, densest tissues around the joint. I'm going to add a little extra here, boom, and release. Now you can see that little bit of spring and back there at this joint of the index finger. That's a recoil spring test. Take up the slack, spring at that dense layer, and then see if there's motion there. If there's not, that's what tells us that we need to treat that joint for a deep fascial restriction. So to recap again, we've got spring testing as the traditional way to assess micromotions in the joints. The reason that is not that effective or that accurate in most cases is it's only taking up the initial slack in the system, never fully accessing and being able to sense that deeper joint fascia. The recoil spring test allows us to go all the way up to that barrier of the fascia and to see if it'll give us that little bit of extra movement that's needed, that little bit of micro motion, that little bit of gliding there. That's the essential building block of all the larger motion to happen the way that it's designed to happen. without compensation and without things stacking up to where we have symptoms of pain like active trigger points that are really caused by these deeper restrictions. So we're going to wrap it up there with understanding recoil spring testing, and moving forward we're going to talk about principles of treatment before we move into demonstrating some assessment and treatment for you. I hope you've enjoyed this video, and I look forward to seeing you in the next one.